Hey, it's Dr. Shelley. And the Bible says, you have not because you ask not. And guess what? You ask, so you're about to have. I have a huge Black Friday sale going on. You can thank your colleagues because they brought it up and I thought, you know what? I am going to do a Black Friday sale. I did one last year and the year before. I don't know why I wasn't thinking about it. So listen, because this is a kick-ass sale. What can you win? Well, there is a quiz attached and you can win almost half off everything and definitely half off of classes in Cleveland. So what do I mean by that? Well, if you have failed this test a lot of times and you are willing to take the full NCLEX course here in Cleveland, which is anywhere between 2, 3, 4 weeks or up to 5 months for those who need it, we are having a half off sale. Now, if you know anything about that non-traditional, delayed, not denied class, you know that up to 5 months in my class for high-risk students who may have failed numerous times or graduated 20,000 years ago, you know that that's usually about $1,000. Well, now it's half off. So $589 is all you can look forward to paying if that's you. Number 2, the second class that is almost half off is the traditional class for those who just graduated and are smart enough to contact me within 30 days of graduation. That class is usually $589. Well, guess what? Half off. You will get that class for $300. I mean, that's a steal, right? Now, the next thing, maybe you don't need a delayed, not denied class for high-risk students who are international or they failed 10 times or 5 times or 3 times, or they took their nursing program 10 years ago, 5 years ago, 20 years ago. Maybe you don't need that delayed, not denied course. Maybe you didn't necessarily just graduate and want to come up to Cleveland and take the course for traditional students in the classroom for up to, again, 5 months if you needed it. Some people are pregnant, they might need it. Or if you are out of town, you don't have anywhere, any address near Ohio, and you want to get my resources instead, like the pink packets. Everybody knows about the pink packets. The pink packets, the Oh My God study guide, which has the entire test plan in it and all your quickies for pharmacology, prioritization, delegation, diets, positioning, all your precautions, your physiology for shock, your everything, like electrolytes, everything. That plus procedures, which is your reduction of risk and basic care and comfort, over 500 procedures in there, like IV insertion, blood administration, NG tube feedings, colostomy, colonoscopy, all of those things, dialysis, insertion of catheters, ice packs, sitz baths. You have in here your oxygen therapy. You've got your canes, your walkers, your crutches, every procedure you need to know. Your SCDs, your CPM machines, your ventilator alarms, everything. That's number 2. Or the management of care. Here in management of care, which is 20% of your test, you have all of your ethical, legal, your SBAR, your workplace conflict. You have your DNR, your advocacy, your ethical legal terms like paternalism, beneficence, non-maleficence, justice, your patient advocacy. You have in here your malpractice, your torts, your negligence, your delegation, your prioritization, what can LPNs do? All that is in here. And infectious diseases, contact, droplet, airborne precautions, standard, protective, what kind of PPE should you wear in the room, what are specifics about certain diseases, what about the antibiotics and vaccines? You got it. It's in the infectious disease pink packet. And don't forget your EKGs, LPNs and RNs must know their EKGs. That's why I advocate for LPNs and RNs to take the UWorld RN, because the UWorld LPN doesn't have the EKGs. And I teach them in class fairly quickly. So you have your EKGs. The next pink packet, pharmacology. This is an alphabetical order pharmacology packet in which it's a quick grab for you to highlight any medications you need or make flashcards. My favorite, the 2024 medication categories, in which you should be learning your medications through categories. So you should be knowing your beta blockers, your calcium channel blockers, your ARBs, your loop diuretics, your steroids, your DMARDs, your biphosphonates, your ADHD drugs, your asthma meds, your COPD meds, your GI medications. Yeah, all of that. And then, of course, psych meds. Psych meds are the hardest on the test, and 75% of the medications on the exam are psych meds. So I got you. Now, what's that all about? Well, look at here. The pink packets sale, normally $99 through PayHip or $88 through me, is now $50 for the Black Friday sale. So again, you get all of these packets for sale. Then we have the most popular part of Shelly's Nursing Review. We have our 3-day boot camp. We have them periodically, about every 6 weeks. So the next one we're having is January 17th, January 18th, January 19th. Our Black Friday sale says that you can get the 3-day NGN NCLEX boot camp, where we spend 3 days of reviewing the NGN test plan, which is the study guide for NCLEX. And we go over management of care, reduction of risk, pharmacology, basic care and comfort, psych, case studies, and more. And then we also include all the pink packets you just saw me demonstrate. Now, all of this makes me want to dance, because all of this shit, all of this 3-day boot camp stuff I'm trying to hook you up with, normally $399, now it's $250. Now, what's the quiz? All right, I'll be honest. You have to answer the quiz by texting me at 216-410-0936. And a lot of my quizzes are very difficult, not this one. In fact, you can still win the Black Friday sale if you only get a 50% on your test. Your little quiz, you might suck at it, and that's okay, but you gotta try. Here's the quiz. What are you thankful for? Yeah, I need to know, what are you thankful for? Because frankly, we've had a lot of turmoil this year politically and all of kind of ways you can imagine. And I'm sure your life isn't the greatest, and I would dare say mine has its drawbacks. But we must be thankful for something. So what are you thankful for? To be honest, I'm thankful to be alive and happy and healthy, so that I can enjoy my family, my friends. And I know it sounds really cliche and quirky, but I fucking love y'all too. I don't know, I kind of like you. What am I gonna do? I like teaching. I enjoy you. I enjoy helping you succeed. I get fucking off on it. Yeah. What is my favorite color? Hint, hint. Can you see that? Can you see that color? How many times have I been married? Well, I did say you can get 50% and still win. Name, now this one you have to do correctly. Name 2 risk factors for failing the NCLEX. In other words, part of my life is teaching you where you went wrong if you failed the test. Part of my life is helping you learn what are the risks for failing this test. You need to name me 2 risk factors for failing NCLEX, and you win. God bless you. Deuces.